welcome to this week's Global Cafe. As mentioned, my name's Roxana, and I'm very excited to be moderating today's just great discussion with Dr. Erin Wallace and Dr. Nic Lochlainn on the work of the Immunization Agenda 2030 Strategic Priority 4 Working Group, Life Course and Integration, which is actually a very timely topic with this week being World Immunization Week as well. Now, to get started and to brief everyone in on our key experts' backgrounds today. So, Dr. Nic Lochlainn is a technical officer in the Life Course and Integration team in the Department of Immunization, Vaccines, and Biologicals at the World Health Organization. Within this role, she is the focal point for integration, life course vaccination, missed opportunities for vaccination, and home-based records. Laura also co-chairs the Immunization Agenda 2030, IA 2030, Strategic Priority 4, Life Course and Integration Working Group. As well, Dr. Erin Wallace is the lead for the Immunization Delivery Science team in the Global Immunization Division at the United States Center for Disease Control and Prevention, the CDC. His team supports a broad portfolio of activities that include technical assistance and evidence generation around several life course and integration strategies across priority countries and geographic regions. Erin also co-chairs the IA 2030 Life Course and Integration Working Group. So a very warm welcome to you both today, and thank you very much for your time to discuss the work of the IA 2030, the Immunization Agenda 2030 Strategic Priority of Life Course and Integration. Now, to start things off, and I guess as a background and introduction to everyone of the agenda, can you, Laura and Erin, please start off by describing the agenda? So what is the Immunization Agenda 2030? What does it hope to achieve? And could there be some intersection with the decade of healthy aging?
Hello, everybody, and thanks again for this invitation. It's great to have the opportunity to speak with you all today. In terms of the IA 2030, which stands for Immunization Agenda 2030, the vision of this is to have a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. And it's a global strategy for immunization for the next decade. And it was endorsed by the World Health Assembly back in 2020 with the support of countries and partners. And it's been endorsed really as a new global vision and strategy to address the challenges over the next decade with the view to saving over 50 million lives. And the way the IA 2030 it's structured, it has 7 strategic priorities, and as part of those, life course integration is one of those. But it also covers commitment, demand, coverage, and equity, and it also has outbreak and emergencies, as well as supply and sustainability, research and innovation. And the overarching theme of IA 2030, or of the strategic priorities, is immunization programs for primary healthcare and universal health coverage. So that's the kind of how IA 2030 is kind of the strategic priorities are laid out, but they're informed by 4 core principles, which I think are very interesting. And I think it's an approach that many have to try and adapt towards. And the thinking is around having people-centered approach, where we think about the individuals who we're trying to reach, country ownership, which I think is something that is often lost in many of these global strategies. So I think one of the main drivers is having country ownership, partnership based. And I think that's another effort that I think is quite important. And instead of everyone having their own, I suppose, goals and agendas within the organization, we need to have like a partnership based approach where we try and work together to achieve what is proposed as part of IA 2030. And then making sure also that there's a data-guided approach. So that in general kind of summarizes the general IA 2030, the strategy for the next decade. So if you want to add anything further to that, Erin.
Yeah, just to add too, in terms of the work around the decade for healthy aging, I think there is a lot of overlap in terms of the different strategic priority areas within IA 2030, as well as the impact areas for the decade for healthy aging. And there's a lot of synergy that's possible here. And I think within our particular strategic priority area, life course and integration, there is in particular a strong overlap in terms of building out a health system that is able to provide services across all age ranges and to be able to ensure that there's healthy living throughout the entire life course.
Well, thank you very much both for that very comprehensive answer. And I guess just building off of that with specifically the strategic priority 4 of life course and integration, how can civil society across sectors and disciplines be involved in promoting the principles of strategic priority 4?
I can start this time around. I think there's a real critical need to be able to go beyond the traditional focus that the immunization sector has had around childhood immunization, around being very focused around just immunization services in terms of thinking about expanding services to these newer age ranges, to be able to have a partnership lens when it comes to thinking about a life course approach to immunization programs. And this very much reflects the fact of why we have life course and integration together. Traditionally, on the childhood immunization side, the integration aspect has been around how can we utilize immunization visits as an opportunity to link in other health interventions to provide a portfolio of different health interventions for children. Now, as immunization programs have looked forward to be able to expand out in terms of providing vaccinations to older age groups, really we see the flip side opportunity where there's a need to really reach out to existing health interventions that are reaching these older age groups, and also to really go beyond the health facility, to be able to partner with those different organizations that are already reaching these priority populations within that we are also trying to reach for older age vaccinations, whether it's pregnant women, older individuals, healthcare workers. There's a real opportunity here for bringing in that integration aspect. And I think we have a huge potential here in terms of connecting with organizations that would not typically be seen as part of the immunization sector, yet are reaching these populations already where immunization services want to integrate together and see how we can have higher coverage for newer vaccines and even existing vaccines that are targeted at these older age groups. Over to you, Laura, for anything I missed.
Yeah, no, I think one of the points that Erin made there about during childhood immunization platforms, we see that a lot of other programs add other interventions onto that platform. And then as part of the work that we've been doing on missed opportunities or vaccination, we see that when children go to other health contacts, they aren't screened for immunization. They don't receive those type of interventions. So I think the mindset of trying to have a more, I suppose, comprehensive, essential package of services, or ensuring that when people do access our services, that they are, not just targeted for one specific intervention. That's a very big mindset change that's going to have to really encompass a lot of work over the next decade. I think I don't even know if it'll be achieved over the next decade, but I think the mindset shift is huge. Because not only is it because of the way funding streams are assigned to many programs, but it's also because of the way in which I suppose how health workers are trained, and also sometimes the structures aren't in place to offer different interventions in different contexts. So let's see what happens over the next decade. But I think it's certainly with the COVID-19 vaccination, we've seen huge changes. Unimaginable changes over the past 3 years, that I think has accelerated hugely the mindset thinking around, okay, I can't deliver this in this situation. I'm going to have to think about and discuss with others. And I think CSOs and having kind of the community engagement, ensuring that people know how to access these services and benefit them will be really, really hugely beneficial. And I think the importance of CSOs and other organizations, I think is something that we really need to try and engage on further and try and ensure that it's not only being driven by one particular program, but I think that primary healthcare approach and ensuring that, yeah, that aspect is taken into consideration will be very important.
Well, thank you very much. Now, Laura, you actually previously mentioned the core principles of the agenda, including a people-centered approach to vaccination. Is a person-centered approach empirically related to health outcomes? And if so, what data needs to be collected and analyzed to benchmark progress?
So I think it was very interesting. There was a meeting this week, and a lot of people talk about cost effectiveness and the benefits of having a more efficient system. But I think people often forget about the end user, the individual who's coming to the health facility, potentially multiple visits, receiving single interventions, and having that more consolidated, like I said, essential package of services could be, cost effective for the health facility, but also in time. A lot of people forget about the cost benefit for us, that individual accessing our services. In terms of monitoring and looking at the aspects of, people centered, I think, in immunization, we're pretty strong on monitoring our indicators in terms of immunization coverage. So ensuring that we can have, I suppose, good monitoring evaluation occurring where we can track, do we see, I suppose, increased coverage, and this is, I suppose, links to the discussion on integration. We see that sometimes if an intervention is provided that the end user accepts, that they may be more incentivized to come for the health facility visit because of that intervention. Therefore, if other interventions are offered that they also accept, we will see then that those interventions also increase, the coverage for those interventions increase. So that's kind of, I suppose, one of the ways in which we can track things. However, different programs track and monitor their interventions very differently. Just for example, for childhood nutrition, immunization is very reliant on the home-based record, which is the document used to track and keep monitoring of interventions received at the health facility level. But some programs, they may have multiple pages within the home-based record, but actually don't use any of the information in that, and they will do their own survey separately. So there's, sometimes the interlinkages even between programs within, the same, childhood platform are very different. So like if we're thinking about older populations, again, there'll be much different interventions being provided in different countries, different contacts. And I suppose it's about how you can ensure that, these can all be recorded in the same place, so that when someone does come along and say, I wonder what's happening in terms of analytics and in terms of how we can, monitor and see if this is leading to improvements, having that information available is a first step. And sometimes it's not available.
Thank you very much, Laura. Erin, is there anything in addition to that you'd like to add on?
The only thing I would add, and Laura's question really gets very nicely at the thinking about the impact indicators. And I think one of the considerations here too at this onset of real push around life course approach to immunization is thinking too around considerations for process indicators that could help with monitoring whether this is a people-centered approach. And I think we definitely recognize that there's this real need to go beyond the traditional health system in terms of how childhood immunizations have been delivered, and bringing the services closer to those communities, to those individuals who are older, adults, health workers, pregnant women that haven't traditionally been a part of the provision of vaccination services. So thinking a bit around where those vaccination services are being provided, in the sense of are they being provided in locations that are more convenient for adults, and then also the different communication channels that are being utilized. There's some consideration here in terms of thinking through that set of process indicators that could help us with measuring whether the approaches being used by countries are considered more people-centered, in terms of just making it more convenient to the end user, to adults, in terms of being able to access vaccination services, and ensuring also that there's a high level of awareness among that population as well in terms of the benefits for receiving those vaccinations too. So just that's the only add I'd have on Laura's nice answer.
And just to add on to the point that Erin made there, we see that in some countries, even for pregnant women, what can happen is they may receive an intervention at one clinic and then be told you have to go down the road to the other clinic to receive your next intervention. Now, I mean, in the interest of time for many people, they might be like, maybe it's not that important if I have to go to that other health facility. So this leads to missed opportunities. And I suppose that's why having that approach where we try and make sure, particularly for populations who may have access issues or disabilities, then, you know, we have to ensure that care can be provided in a much more straightforward and I suppose pragmatic way than telling people to go to, you know, potentially 10 different clinics for different interventions. And yeah, some will prioritize some over others.
Thank you very much, both. And I guess taking on that point of access, we do have a question in the chat by Mr. Shmuel Yerushalmi, and he was wondering whether the IA 2030, the Immunization Agenda 2030, can better support effective access to immunization, and more specifically in lower socioeconomic groups or populations.
You know, I think this really gets even more broadly, not just to the life course approach, but, you know, more broadly to the coverage and equity goals around IA 2030. One of the big areas of focus for IA 2030 are around those populations that are chronically missed. And, you know, we often in the immunization sector will have coined the term zero dose communities. These are communities that health services in general, not just immunizations, are failing to reach those communities, and there's consequently very low coverage for immunization services and other health services. And unfortunately, I think there's a very strong connection here in terms of those communities that are also the most marginalized as well. And so I think part of this is really being able to lay out different tools that countries can utilize in terms of helping to identify where these communities are, and also being able to help in terms of the advocacy around the importance of reaching these communities to be able to protect them against vaccine preventable diseases. That this also just generally benefits the entire country in terms of reducing the risk of larger vaccine preventable disease outbreaks. And I think this really just cuts across not just provision of vaccinations for older age groups, but, you know, for children as well. But as you can imagine, there's a very strong tie in terms of those communities that can be chronically missed for childhood vaccinations are also going to be the communities that are going to be facing the biggest challenges when it's provision of vaccination services for older age groups as well. And we saw this quite a bit even with the COVID-19 vaccination experience, which really was the first for many low and middle income countries that were trying to reach older age populations with a vaccination intervention, and many different strategies that were tried out and were seen as very promising in terms of moving forward, in terms of, say, for instance, using mobile health teams to reach out to those populations that are very remote, rural, ensuring that there's utilization of a wide cadre of different health workers, not just those that are your traditional vaccinators, but also can you utilize community level health workers and build up their expertise to be able to train them on both mobilization around vaccination for these older age groups, as well as, if capable, if possible, also provision of vaccination for these older age groups as well. Over to you, Laura, for anything to add on there.
No, nothing further to add. I think you know, the coverage and equity aspect is a key area at the moment. It's a key area of focus, particularly around zero dose communities. And I think to Erin's point, when we talk about these communities having, you know, vaccines and, you know, or having very low coverage of vaccines and low access to vaccines, I mean, it doesn't, you know, it's clear that they also have no access to other health interventions. So what we're trying to do actually with this zero dose agenda is also make sure that rather than thinking solely about immunization, I think that's something different about Erin and I, when you have an integration focus, you also think about the other options and opportunities that can be linked with immunization. So I think when it comes to that, trying to reach those communities that have been missed, that you don't only target them with only one intervention, you try and have other essential interventions that the communities may require.
Well, thank you very much, both, and thank you, Shmuel, for your question. We also have another question in the chat by Miss Catherine Klein. Catherine, may I please ask you to unmute and pose your question?
Basically, I, like many others who live in countries without universal health care, keep encountering the sort of one-dimensionality that you're talking about, you're trying to overcome. So for example, trying to get typhoid vaccination, I discovered that's not included in healthcare coverage because it's not perceived as something that's essential. It's part of wanting to travel. So it's very expensive. And I can afford it, but most people, I'm sure, can't. So the question is, how do you deal with the insurance companies that I think are a huge limitation because they basically determine who gets what kind of support? So how is your effort addressing their intransigence to look at the world holistically?
I think maybe I can start on this one. I think I'll take a little bit of a step back on this. I think in the sense of this kind of question, what we really in the immunization community in developing this life course and integration strategic priority area really recognize that we are not the experts here in reaching these older age groups, and that there is a need to really be able to partner with all the different agencies and organizations that have been very focused on adult provision of adult healthcare services. And this is partly why, in the working group, we have Jane Barrett here on the International Federation on Aging to be able to bring that expertise to an area that's really in the global immunization community, we are still relatively new to connecting into. And so I really see this as part of our learning agenda in terms of exploring this further, in terms of how do we document and build out an answer to your question over the next several years, because this is something that has not been really a component of the different areas that we have been trying to traditionally generate evidence on. So I think that's something that I think it's an excellent question and really is a part of that evidence base that we need to build out better in terms of tackling these types of questions, and why for our integration and life course integration working group, we are really trying to build this out as a fairly diverse group, and also recognizing that this community of practice that is really starting to begin around life course and integration is something that we realize needs to bring in many non-immunization people that are reaching across health interventions, not just for childhood, but also for older age, to be able to help understand and answer these kinds of questions. So I'll turn to Laura and see if
I think I
she has
may
anything
not,
to
I'm
add.
sorry to interrupt. I think I may not have been clear. I was actually addressing for all age groups how you deal with changing the mindset of insurance companies that tend to support payment or coverage based on an individual vaccine or vaccination. So how do you bring to that enormously important group with a lot of power over our lives your holistic approach?
Yeah, I do think this is a really good question, and I think part of this is perhaps partially answered by the focus that we have around supporting and empowering national immunization technical advisory groups to be able to build out their expertise when it comes to the vaccinations that they recommend within national immunization schedules. And not only for childhood immunization, but also building out the expertise within these advisory groups for adult vaccinations as well. And I think this is something that really can underpin many of the decisions that large health insurance companies can be making in terms of what is recommended by the national government, and what they can oftentimes fall back to say, okay, this is going to be part of our preventative care package for our insured clientele. So that's one aspect in terms of a consideration here. And I do recognize that it's a challenge. It's also very country specific, as well, in terms of the challenges that that individuals face when it comes to this ability to cover the costs of these different vaccinations, but also to ensure that there is this whole health life course approach to provision of their health services.
And I think, Erin, the word you use there is cost. And I think that's part of the problem, Catherine. I think what can happen is that different countries procure vaccines from suppliers, and one country can be paying X amount, and the country right neighboring beside it can be paying double or half. There's no control measures. And I think at WHO, there are, colleagues who work on the market shaping and looking at, how much country they're paying. It's MI4A, so it's a marketing information for action. And, it's an area that is, it's quite sensitive. So some countries don't want to disclose sometimes, how much they're paying for some vaccines. Also, some countries are receiving donor funds. So some of their vaccines are subsidized. But from the insurance side of things, some countries don't have any insurance whatsoever. So the countries are reliant on subsidizing those vaccines that are delivered through their programs. But it's an area that is hits on equity also considerably, because if an individual wants to receive a vaccine and to be protected against vaccine, and their insurance doesn't cover it because of the cost or for other reasons, so I think it's something that we could also probably interlink and share with our colleagues working covered in equity, because many times the question when we do discuss life course vaccination and the life course approach to vaccination, people are like, how are we going to pay? How is our country going to pay for these vaccines? Because it's sometimes some countries at the moment do not have a vaccine to protect against pneumonia in children. The country can't afford it. They can't introduce it. The country can't see long term how they can afford it if their donor funding finishes. Some countries don't have a second dose of measles. Some countries have had second dose of measles in their schedule for decades, and some countries still don't have a second dose of measles. So, we're seeing that this is sometimes it's an issue around funding and government financing, and the government allocating funding for certain vaccines. But then when you go up some levels, and then you have the healthcare being, I suppose, being supported by insurance companies, then this is sometimes another aspect that can hit on equity issues and not providing. There are not just immunization, but there are many who can't access many services as a result of their insurance companies. So it is another area that I suppose requires some more engagement. But I do know that around the coverage and equity lens, there's certainly discussion around social protection. That's an area I think that's very untapped in many countries, around thinking around what social protection can provide for individuals who want to have better access to healthcare. So I think for the equity side of things, that's something that I think will be built on more strongly, because there's an equity reference group, and I think this is something that they discussed earlier this year. So let's see, as part of that thinking with all the partnerships, maybe there will be advancements over the next decade, and I hope there will. But I know that it's certainly an area that can be very unfair, and depending on one country next to the other having completely different infrastructures or systems in place, it can be very demoralizing, I think, for many populations.
Well, thank you very much, Catherine, for your question, and Dr. Wallace and Dr. Nic Lochlainn for the response as well. And I guess shifting gears a little bit towards actions to support the strategic priority 4. Laura and Erin, what are the tangible actions that organizations, healthcare professionals, and key stakeholders can really take to support and help inform strategic priority 4 as part of the Immunization Agenda 2030 and, arguably healthy aging as well?
I could start. I think to build a little bit on Laura's previous answer here, one of the big gap areas that we have identified is, and it's not something that people traditionally would think about when it comes to provision of services across the life course and how do you really push forward on this, is that there needs to be very good surveillance systems in place to help to understand the burden of disease. And this is something that really underpins that economic argument for providing vaccinations for all age groups. And this is something that's the kind of evidence base tied with the economic costs of provision of those really underpins the provision of the vaccination when it comes to looking at the economic rationale for introducing a vaccine in a country. And that's something that's for these national immunization technical advisory groups really forms the basis of their decision-making process when it comes to what they recommend a government should endorse as part of their adult vaccination schedule. And that's something that is a real big gap here for many countries in terms of their surveillance system that's also supporting and covering vaccine-preventable diseases that are targeting older age groups. And that's an area where I think there's a big opportunity to expand and ensure that there is an evidence base at a local level to be able to understand better for a country if it makes sense yet to introduce a given vaccine, but it also helps an immunization manager to make the case in a very local fashion to the rest of their government counterparts in terms of the rationale for introducing the vaccine. And it also underpins the future communications that you're making to a population when it comes to helping them to understand the benefits of getting vaccinated oneself in terms of that risk. And that's something that's seems very upstream, but it's also very critical before you're really laying out how are we going to deliver this vaccine, how are we going to communicate about this vaccine. And that kind of piece is just really part and parcel when it comes to how we need to think about the structure of a immunization program that's reaching across the life course. So that's one thing I'll mention. Maybe I can turn to Laura for other ideas as well.
Thanks, Erin. I think it's good to think about what the overall goal of this life course integration strategic priority, and that's to make sure that all people benefit from recommended vaccines throughout the life course, and that they're effectively integrated with other essential health services. And I think this is a big shift in thinking. And I think, as I mentioned previously, the thinking around COVID-19 vaccine delivery and how that can be delivered outside of the typical essential or expanded program immunization infrastructure, that's going to be a big mind shift thinking. And I'm seeing it at the moment because I'm involved in, there's a COVID-19 vaccine delivery partnership, and they're trying to engage with non-immunization partners. And it's some programs are more keen to have the vaccine delivered than others, and it's very, I think the way in which our structures are being put in place and the funding is being put in place, that everybody thinks very vertically. It's like everyone has their goal for their program and that's what they're trying to achieve, but the thinking needs to be much, much broader. And I think that's something that it's going to have to be changed, because that hasn't been working clearly. And that's why if there's an opportunity, rather than having this single-minded approach,
I think we lost Laura for a few minutes, but until her internet catches up, if you don't mind, I actually might, Erin, ask Eileen from the chat to pose your question, Eileen, if possible.
Good afternoon here from Ireland. Thank you very much, Laura and Aaron. My question is very much linked into the last few minutes of inputs. As an older person, I don't have a checklist as regards what I can expect to receive in the form of vaccination throughout my life course. I'm talking to my friends in the UK and in Europe, and they have automatic call up, say for shingles, once they reach 70. They've automatic call up for flu. Now, you hear about the flu vaccine, but even with the recent COVID vaccination program and immunization, we're reading in a newspaper today that people should now be called up for their spring and their autumn COVID, probably 5th shot, but there's no public relations on that. There's no public broadcasting. And I would love to have a checklist. So is that one of the things you're trying to do throughout your life course, a checklist, both on immunization and maybe preventative scans, because they tend to be ageist, to say the least? Thank you.
Excellent question. And I'll add into the chat the WHO recommendations for vaccinations across all age groups. They have a very nice set of tables that provide a starting point for all countries in terms of considerations regarding provision of WHO recommended vaccines and the evidence base around each of those vaccines. And there's one for all age groups, there's ones for children, one for health workers as well. And I think that's a really nice starting point. And it's something that these are ones that for a country, for oftentimes their National Immunization Technical Advisory Group, can act as a starting point for what they should be considering in terms of recommendations to add into their own schedule. And I think this goes back to what Laura was saying earlier in terms of, a question about why don't all countries have the WHO recommended vaccination schedule. And it's oftentimes it is a financial constraint. There can be countries that want to have better understanding of their own local situation when it comes to the vaccine preventable disease of interest. And those two together are often where we see a sticking point for countries when it comes to being able to add in additional vaccines into their schedule. But at least for a starting point in terms of that global level, the WHO recommendations there for their immunization schedule is available and is something that everyone can access. And then it's really becomes the country standpoint in terms of what they're going to introduce and support. So I just added that in the chat box, and I'm sure Laura can add more.
Thanks, Eileen. I think I know a little bit about the Irish system, considering I'm from there. But I know that countries do, as Aaron said, countries do take the approach of how they decide on what vaccines to introduce. It is down to the national health system itself to communicate what interventions are available for what age groups, and different countries take different approaches and also they also decide on which vaccines that they also will provide. So I think the communication aspect, and we have a group that work specifically on demand, around immunizations. How can we ensure that there's decreased hesitancy but increased demand around vaccines? And that communication aspect is key, and clearly communication needs to be improved around what vaccines people are eligible for in the different age groups. I suppose it goes back to my point about the home-based record. So for a child, for typically an infant or a child below 5 years, they will have a card and you can see what age each vaccines are being given. But clearly as time goes on, sometimes that card is lost. But then sometimes for other populations, that card hasn't been established or developed with that record. And I do know, and this is something that we say a lot, is we're in the middle of paper-based and digital, but digital doesn't help for everybody. But hopefully with time that will improve. But I think the fact that you're not aware of when your next vaccines are due, that's not great. I know that in Ireland it is the general practice system that you are called into. So it's every country is different. But I think there should be more clearer time points and timelines for when someone's about to receive or eligible for a vaccine. Otherwise, other things will take priority and that opportunity will be missed.
Thank you very much, Eileen, and thank you, Laura and Aaron, for that response. So we know that today is a part of World Immunization Week, and World Immunization Week brings people together from around the world to highlight the importance of vaccines and how they really protect people of all ages against many vaccine preventable diseases. And the big catch-up is the theme of this year. So would you say the big catch-up is the big catch-up essentially across the life course, including older adults? or should there be greater focus on other groups, such as child and maternal health?
Go ahead, Laura.
No, you can go ahead.
So I'll get us started on this one. Yeah, I think it's certainly there is an adaptation to the World Immunization Week in regards to the current status across the world in terms of the regions and the countries and what their existing immunization schedule is. And I'll give as an example, the region of the Americas has a heavy emphasis on catch up of vaccination across all age ranges. And part of that is really driven by the fact that in the region of the Americas, they have really been a trailblazer when it comes to having a life course approach to vaccination for over 10, 15 years. And so many countries already have vaccinations in their national immunization schedule across the life course. And so part of the thematic push within that region is ensuring that it is about catch up of vaccination across all age ranges. I think as a note here in terms of where we don't yet have immunization schedules that have adult vaccinations in the schedule, this is really an opportunity to provide advocacy around being able to build up a catch-up vaccination policy in those countries and really create awareness around the importance of countries having a catch-up vaccination policy, really as a first step and part and parcel of the life course approach to vaccination. That it isn't just about creating a new vaccination visits where you're providing a recommended vaccination at whether it's 15 years of age or 50 years of age, but those are also opportunities to screen those individuals for any earlier missed vaccinations as well, and to provide a catch-up opportunity for those earlier missed vaccinations, whether it's an adult coming in for their influenza vaccination and you can screen on COVID vaccination status, or a booster of another needed vaccination. This is really what the broad thematic underpinnings are of the big catch-up approach.
But as Erin said, it is very regional specific. And I think in certain regions, the emphasis will be more strong on children, given that throughout the pandemic, schools were closed, children were missed, the risk of many serious vaccine preventable diseases is quite high in a lot of countries. So there's predictions for large measles outbreaks in many parts of the world now. So there will be, I suppose, a strong emphasis placed on different regions on which groups that will try and catch up. Also, we have to think about adolescents, which is another group that typically, are many countries still don't have vaccines in for adolescents. So that's a group many young girls missed out on HPV vaccination throughout the pandemic. So I think that's, I suppose, part of the shift in thinking. But my question has always been when this was launched is like, are we thinking life course? Are we thinking broadly? Are we thinking about all the life course stages? But I think it's going to be very much dependent on the region and also country context. So I think we would have to see what countries do. But just to say that I think if a country does have an approach to have life course vaccination, I think they will take this big catch approach to address that. If not, then they may focus on other groups.
Thank you very much, Laura and Erin. I see Dr. Jane Barrett post a comment and a question in the chat regarding immunization in long-term care. Jane, can I please ask you to speak regarding that?
Look, thank you. And what a terrific session. Thank you very much to Laura and Erin. The IFA supports and promotes a life course approach, and that's from children all the way through. And I think any organisation that's interested in health and wellbeing has to do that. Our focus may be on the end of life, but of course we've got intergenerational approaches as well that we need to be advocating for. My question is really about, a growing proportion of our older population in every single country of the world that may require to be in a long-term care facility of some kind. And that's across the world. And we know that this is happening and there's going to be more of a need. It's really a question. Do you think that we need to actually pay a little bit more attention to ensuring that the routine immunisations programs that are available actually are implemented in these facilities. So let's assume that they're fully reimbursable, they're paid, and because it's important to ensure that even as we grow older and perhaps more frail, that we still have that right to be vaccinated. So, one of the action areas of the decade is long-term care. So it seems to me that aging and health and vaccines and diabetes and frailty all need to be coming together. So what's your perspectives about not highlighting, but just paying a little bit more attention to this group? Thank you.
Yeah, I can get going. I certainly agree with you, Jane, that this makes a lot of sense to be able to prioritize this population. I think it really aligns with an approach in terms of thinking beyond the health facility and how we really need, as an immunization community, to think about what it means when we say outreach beyond the facility. And we have a traditional approach in the childhood immunization sector of going to a community and for outreach vaccination sessions. And here, this is something that is a bit akin to our approaches that we've been taking when it comes to provision of vaccination services or screening for vaccination at schools. And this is, there's certain rationales for this in terms of knowing that this is where we can find individuals easily. We want to make immunization services more convenient. We also realize that this is an opportunity to be able to both provide recommended vaccinations at that age range, but also to be able to catch them up on earlier missed vaccinations. And I think this is the same for the long-term care facilities as well. And I think this is really something why it's great having you as a part of the working group to think through these types of opportunities when we really getting into the details of what it means when we say a life course approach to vaccination and how this has this integration aspect to it. And we, knowing a bit more on the United States side, how we focused on COVID vaccination and rolling this out to those populations that were most at risk of COVID vaccination. That was something that became a key part of the CDC activities when it came to understanding which communities are most at risk of disease and where do we really need to have a very strong and well-defined strategy. And I think this is something that really is going to be a critical aspect of further guidance when it comes to the life course approach and when we're breaking down the age-based platforms for older age groups. Like this certainly is a key part of that strategy that really needs to be elaborated further.
Thank you very much. Thanks, Aaron. Thanks, Laura.
Well,
just to add to that, though, I think, Jane, another aspect of this that may help is when we think about the healthcare workers who work in these long-term care facilities. If we interlink that with ensuring that there is better access or provision of vaccines to those groups in those facilities and include healthcare workers, that could be another angle and aspect that needs to be taken into consideration, because that could also prevent disease spread within a healthcare facility. And to say that these healthcare workers are actually a group that sometimes it's quite challenging. Sometimes they get screened when they're intake of their training, and then after that, it's like no one knows what happens. So by ensuring that they also get their annual influenza vaccine to prevent spread within the long care facility, I think also COVID-19 vaccination will probably be something that will happen in the long term, making sure that their measles vaccinations are up to date, because sometimes that can cause spread. So having that interlink could also be another aspect and key thinking around the occupational side of things, and hoping that could then strengthen some type of policies being put in place within long care facilities so that nobody's missed.
I just think we live in this amazing time where, yes, we've been in the middle of a pandemic at the same time as the decade, at the same time as IA 2030. at the same time as these strategic priority working groups. And, it's about all of us coming together. And even if immunisation is not your core business, you have a voice if you're representing any citizens across all ages. So, I'm urging all of our members and stakeholders to take an interest in this, because their voice is just as important as yours and mine, at the table to create that solution and work to implement it on the ground. So that's why I think it's such an important time, particularly, in World Immunisation Week. So thank you for your comments. Appreciate it.
Well, thank you very much, Laura, Erin, and Jane for all of that. And we are slowly coming close to the hour, but I think just one last question prior is, how can these fields, so the fields of aging and immunization, just better integrate global guidances, including the IA 2030 and the decade of healthy aging, to just achieve this distinct and unified voice for older adults and vulnerable populations? I know you did mention slightly, but just a better way of integrating global guidances.
So I'm going to say that I've been involved in developing many global guidances, and sometimes they require updates and I have to click on links to update them, and I see there's not much, there hasn't been many hits on this. Sometimes it's about knowing which guidance is actually required. I think that's one of the main key things. Targeted guidance that, countries want or need is the most important thing. And I think it's a communication advocacy and on the dissemination. There's a lot of guidance out there that it's important, but when you ask somebody in the country, they're like, I've never heard about this. I don't know what this is about. Even this catch-up guidance that was developed back in 2021, some countries have never heard about it, or they don't know what we're talking about. And when it comes to specifically around the area around catch-up, that requires policy changes. If you want to vaccinate a certain population beyond a certain age group, you can't just do that ad hoc. It has to be a policy in place. Health workers need to be aware of it. There needs to be supply, there's a whole chain of events that need to happen. So I think the advocacy and communication part, and I know, Jane, you're a big advocate for advocacy and communication. I think it is very important, because I think there are certainly aspects of different guidance and different strategies that fall through the cracks because, it's put out there and it's out there, I hit send and that's it. But there's more work that needs to be done after that. So I think with, where there are opportunities to I suppose, spread information and share communications and examples around this. I think that's one of the aspects is sometimes this life course integration approach is people are like, what are you talking about? What do you mean by life course? What do you mean by integration? Because it can mean different things. So I think having an understanding and sharing that understanding can help with, bolstering up and helping, expand, I suppose, some of the information and gaps that may be there. Decreased gaps, expanding information. Yeah. Aaron?
Yeah, I would just echo your comments. I think we're really at this point in terms of having a plethora of global guidance and trying to think through what's the best way to build capacity at the national level. And that's something that I was here in Geneva this week around a zero dose working group, and we were also struggling with the same challenge as well in terms of global guidance around reaching these chronically missed communities, and how do we build that capacity for better understanding that topic, which is the same thing that we're facing on the life course integration piece. And I think part of it is opportunities like this in terms of breaking down what do we mean when we say life course and integration, what is really underlying this. And it goes a bit to some of the capacity building that's needed within the national immunization programs in terms of understanding helping them to understand the benefits and what we mean when we say the life course approach, and also in terms of building out the capacity for these national immunization technical advisory groups, which are their decision-making bodies in regards to introducing vaccines and ensuring that those individuals have backgrounds when it comes to adults vaccination as well. And oftentimes there's very much a a child vaccination focused set of advisors within a group like that, but they're a very influential group that every country has. And if they don't have that kind of expertise, there are opportunities to either bring in that kind of expertise locally or to build the capacity of those individuals when it comes to helping them to understand the benefits and the current status of evidence when it comes to vaccinations for these older age groups. And so that's certainly a starting point. And then helping them to understand, helping immunization program managers to understand, just broadly speaking, how do you approach evolving your program into into an immunization program that's covering provision of vaccinations across multiple age ranges, and getting that understanding that you're going to need to think beyond the health facility is what I oftentimes come back to in terms of being able to reach these populations and beyond our traditional modes of communication and social mobilization for childhood vaccination. Now, on the immunization side, we have many different types of outlets when it comes to engaging immunization managers, whether it's different immunization manager meetings, other types of global meetings where the impetus is a bit on us as a working group, but also just broadly speaking on the different key agencies when it comes to creating those awareness opportunities.
Well, thank you very much, Erin and Laura. Just before we go off to our key takeaways from you both, I'm going to introduce our next week's topic. So next week we have the opportunity to listen to Dr. Mary Bolia on understanding the definitions of mistreatment against older persons. It's going to be a phenomenal discussion, so please do join next Friday. So back to you, Laura and Erin. Can I please ask in a few sentences your key takeaways for us today?
So I think the key takeaway is we have to consider all populations, and I think that's something we do anyway, but I think we need to advocate for that more strongly. I think from the cost aspect, the equity aspect, thinking about that also more broadly across the life course is an area that I think that really needs and warrants more attention. Erin?
Yeah, just to add to, I think this is something that we really need to be cross-cutting when it comes to partner collaboration in regards to a life course approach, that it's not just about immunizations, not just a single intervention, but really being able to link across the immunization community and the health and development community that are also reaching these same age ranges. It's really important for us to be partners here.
Well, thank you very much. Thank you both for the great discussion today, and thank you everyone for joining. We wish you a great rest of the day, and we'll see you next week. Take care, everyone.